I do so many of these. I was waiting for the countdown. Hi, everybody. Welcome to this week's Roundtable with Joey's Legacy.
All right, we're waiting for Carrie to come back. She had a little tech issue there. So how are things, Dr. Cannizzaro?
I would say they're very good, Scott. Why don't you tell us a little bit about you?
Well, we've gone through quite a whirlwind in the last couple of weeks. Lori and our other consultant, Colleen, have done a tremendous job putting that membership site together. I couldn't do that if my life depended on it. You just need so much technical knowledge and know-how, and they certainly know how to do it. And we're looking forward very much to attracting a lot more people to our site. We want to continue our work. We want to continue to build on the documentary. And by the way, you are a star, Dr. Cannizzaro.
You're so sweet.
You are absolutely a star. Everybody loves, I mean, you're the one that really, you're one of the ones that steps forward, that has stepped forward and said, yeah, no, we don't like the way things are, and we want to see change take place. And you are greatly admired for that. I can tell you that. I've had a lot of individual conversations, a lot of private messages, and everybody just loves you. So,
oh, I have goosebumps. Absolutely, I absolutely have goosebumps. Thank you. That's so sweet.
Thank you.
Mr. Bashar was wonderful. And did you get to see the entirety of the interview that he did with me with the documentary, or just small bits of it? Or
whatever's in that 8-minute sizzle reel is what I saw.
Oh, okay. Yeah.
I know there's a lot of film left on the floor when these things get edited. And he must have done a few hours of filming.
Can you guys hear me?
Yes.
Yes.
I don't know what was going on. That is just so weird. I apologize.
Yeah.
And I'm telling you, I have ghosts in my house from yesterday or something, because that was so strange. I am so sorry to everybody. But I'm glad we're back on. So did I interrupt something?
I was just complimenting.
Goosebumps.
I was just complimenting Dr. Cannizzaro for her part in the documentary.
Oh, yeah.
We know that the majority of vets in this country in small animal practice, which I believe exceeds 70,000, are just like Dr. Cannizzaro. They are caring, compassionate. They entered the profession for the right reasons, because they have a profound love for companion animals. And all we focus on at Joey's Legacy is that small subset that choose to do things their own way, not governed by any solid entity. And of course, I'm referring to vet boards who, as we all know, fail to firmly and fairly discipline when it's necessary, which I've always believed would actually create a much better environment for the profession. And I've mentioned this before, veterinarians are number 3 most respected profession in 2006 in a Gallup poll, behind nurses and pharmacists.
Yeah.
And sadly, we don't see them.
We're behind nurses and pharmacists.
Nurses are number 1 every year. The only year nurses were not number 1 in the last 20 or 25 years was 2001 during 9/11, when firefighters made the number 1
eclipsed them.
spot.
Yeah.
But
and don't get me wrong, nurses deserve the position. Yeah. I was just being funny more than anything.
The veterinary community stand, as far as being respected, is dropping, and it's not dropping because of doctors like Dr. Cannizzaro. It's dropping because it's feeding on itself. Like back when I was a vet tech, from each hospital that I worked at, and I worked at 3 or 4 different hospitals, the community grows. So if you have a veterinarian who has veterinarians that come in and he's the head veterinarian or she's the head veterinarian, that stuff trickles down. And then the techs become that. And it's just, it's a culture that is created, hiding stuff under the rug. And so it grows and it grows and grows, which is why the veterinarians like Dr. Cannizzaro are so much more valuable than we even can imagine, is because that is the community we want to spread amongst our younger, more susceptible to it, right? You get this young vet tech who sees the vet who just says, well, they won't know, don't say anything. And it just keeps getting worse and worse and worse. So we have to have our vets like Dr. Cannizzaro and the ones that Scott's talking about. There are many, 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 many of them, but I got to tell you, I'm concerned that some of the other is growing. And, as busy as we keep getting, more and more busy, and the drive to make more and more money, all of these things are becoming bigger factors, and it's so scary. And I don't know if it's because I became involved in Joey's legacy that I started thinking, oh my God, this is like really bad. But it's scary. It's really, really scary.
Corporate medicine and the push for profit. And don't get me wrong, every veterinarian deserves to make a profit and make a good living. Yeah. We worked really hard and spent many, many years in veterinary school. It's honestly harder than medical school, human medical school. And however, the problem that we're seeing is that the push toward corporate medicine is a one size fits all, and it's profit driven. And when you have the large corporate entities that are swallowing up your neighborhood veterinary offices that are successful offices, you're losing that personal experience that you get with your veterinarian, and you become more insulated from that one-on-one relationship that you get with the veterinarian. And it's more, the techs run in and give all these shots, the mambo wombo shots that the animals don't need, and it's one size fits all. So if Banfields and all those other corporate entities keep swallowing the veterinary offices up, people are left with these corporate entities that are starting to look a lot more like the human medicine or human disease care system that we have. And then all we're doing is running and putting fires out and trying to turn a profit, instead of really focusing on problem solving and working diligently with the client and listening to the client. Because even in human medicine, as you know, when you go in to see the doctor, they barely listen to you. And well, let's just look at your heart. They don't look at your whole body. They don't look at your whole being. It becomes so specialized and compartmentalized, and nobody wants to handle the entire patient anymore. And I think that is where veterinary medicine is leading. And it's starting to fall by the wayside in a bad way, more toward human medicine or human disease care system. We need to listen to clients because they see and observe what's going on with their pet. And when we lose that observation and we want to get in and get out and do a bunch of shots, or let's just give steroids and antibiotics for the itching or Apoquel or whatever the drug of the day is, we're not listening, we're not paying attention, and we're not treating the entire patient. We're just putting this and that fire out, throwing them out the door with $70 of crappy shampoo they don't need. And we need to stop and go back, to being, James Harriet or something.
Right.
Personal experience that you have, and that I think is becoming a rarity to find in a veterinarian, whether it has to be homeopathic or otherwise. You'll probably find that more with a homeopathic veterinarian than you will with an allopathic veterinarian, which is more commonly known as the traditional veterinarian. Yeah. You're more likely to find that because the model of send the tech in to do everything, the vet comes in for 2 seconds and poof, that's it. You get very little contact with your veterinarian, and you feel pretty lost in terms of really understanding what's going on with your pet and what are your options. And you deserve to know all of that. I feel strongly about that.
It's interesting when you think about how we have been complaining we as a society have been complaining for many years that the human medical field is just so bad, and you can't get that connection with your doctor. And I've had people say, oh, I wish my doctor was more like my veterinarian. This was years ago. But
Right.
instead of the medical field taking some tips and stuff from the veterinarian field, instead we've flipped our veterinarian field over to just this giant medical in and out, hurry up algorithms and like you said, the drug of the day. And I giggled a little bit because I had a client one time tell me that her vet was trying to talk her out of taking I think it was Apoquel, and didn't want to give Apoquel and thought that Cytopoint was safer and better. And she they kept talking and she says, well, why? And I said, I don't know, maybe he got the Cytopoint for on sale that week. Because it's kind of can happen, if they're out of it, then they'll try to sell you this and that and try to get it going. So it's just, it's just so sad that we don't, I think, when you talk about the relationships that we make with our clients, right? You as a veterinarian, me as, I don't know what you want to call me. I'm a pet life coach. I don't call myself a groomer because it encompasses so much more than that, but I do grooming. But the relationships that we build with our clients is the most valuable tool I have. It's the most valuable tool, and it's one that isn't used. And I think it could protect us from veterinary malpractice, because if you know that client on a more personal level, I think you're less likely to be even the vet himself being victim of veterinary malpractice. Do you know what I mean? Like if I'm right, like I don't think vets set out to be these evil, I'm going to do veterinary malpractice. It's something that happens and it shouldn't happen. And I think a lot of times it happens just because there's not a relationship that was built. Would you agree? Or
whenever there is a break in communication or a break in the trust in that relationship, then we're always at risk of being either accused rightly or wrongly of veterinary malpractice. And communication is hard. I mean, it doesn't matter if you're talking to your spouse or a friend, a family member, your adult child. There can be breaks in communication and things can happen. Feelings can get hurt. Misunderstandings can occur. So communication is incredibly difficult. And when you're a busy veterinary practitioner and you feel under the gun and you've got 5 more rooms to get to, I don't operate that way, but if you do, there's a tremendous amount of pressure to get in and get out and get it done.
Yeah.
Excuse me. It really doesn't enable that much ability to dialogue. And if we start following the human model in that way, then we're going to have more breaks in trust and more broken communications. Excuse me. In my practice, I consider my work with my clients as a team, and we need each other so that I can get the information necessary and understand their pet dynamic at home. Let me see. Forgive me, trying to get that little tickle out. This is a dynamic that without that client, I can't get to know everything that's going on with the pet at home. I can't get to know the intimate detail of what happened. Even if it is something like maybe the pet exhibits jealousy. I may not see that in an exam room, even in an hour's consult or something like that. But if the client is describing to me what happens if she gives her spouse a hug, or he gives her, spouse a hug, and the animal reacts or has a certain kind of reaction, that gives me a tremendous amount of information. I don't know how and of course in allopathic medicine, they don't care about any of that. So that doesn't matter to them. But if we're going to talk about the entire individual, we have to know everything mentally, emotionally, and physically. And I think that allopathic medicine should look at that as well. Because if somebody is suffering badly and they lost an important family member, whether it's a pet, a person, spouse, a child, that is important in how that fits into the dynamic of how the individual is suffering, whether it's diabetes or heart disease or digestive disorders. Just throwing a pill at that does nothing. It doesn't fix anything. And if we don't look at them as a whole, which is why I do what I do as a homeopathic veterinarian, then we do such a disservice in medicine. So if you spend 5, 10, 15 minutes with a client there's no way that you're going to get enough information about what happened. Maybe the pet's best friend passed away. And of course, the vets don't care. It doesn't matter. They're there to give a pill, a shot, who knows what, the drug of the day. And they don't really care about that. Well, the itching started after their, spouse passed away or something like that. Doesn't matter. They get the same drug. So I think that goes into, if you're 10, 15 minutes, how do you build a rapport with that client, number one? And number two, as a homeopathic veterinarian, I just couldn't do it. And I don't think we should do it, because I think we should understand what's going on with the client, because then maybe there's a different focus that should take place for whatever the ailment is that the individual is expressing. And we don't do that in human medicine, and we should definitely do it in veterinary medicine. And there are some veterinarians that do it. They just may not know exactly how to treat that. But kudos to them if they listen and pay attention and take the time.
Yeah, they'll reduce the amount of veterinary malpractice and negligence if they just take the time to talk. And I'm going to throw out a suggestion. I know we didn't really do a whole lot of introductions at the beginning of this because we had some problems, and also because we're in this new membership. I think most people know who you guys are, but really quick, I just want to do a little bit. We have one of our attorneys coming on soon. Lauren will be with us in a few minutes. Speaking already tonight, we've had Dr. Cannizzaro, who you all should know and love, hopefully, as much as we do. And then, of course, Scott Fine is with us, who we wouldn't have this without Scott. So Scott is here, going to help us do a little bit of, just kind of figuring out how we're going to help. Hopefully, I hope that this podcast or roundtable that we do will not only help those who are going through veterinary malpractice currently, which is what we have our veterinarians here for, so that they can review cases and send to our attorneys. But I also hope that this group realizes that we are also here to help those of you who are grieving, not just with your legal part, but your grieving part of it. And thirdly, this new membership that we have is also, I hope you realize, here to protect you from it happening to you and your pets. So I do want to talk, we always talk a little bit about how do we prevent it, but I just want to see if you think this is something that might work. I know you personally, Dr. Cannizzaro, your initial consultation or your initial exams, or when you first see a pet, how long is that, would you say? For one pet, typically it's an hour and a half for the initial evaluation consultation, in which time I take time to, find out as much as I can about the animal, but I go over diet, nutrition, answer questions about vaccination, or educate people about vaccinations or why not to do them. We talk about any lab tests that seem appropriate or that I may recommend. I go over all the medical records that I request ahead of time. And I do a homeopathic workup and a physical examination, not necessarily all in that order. Right.
And excuse me, it really is comprehensive. It covers the whole gamut. And I want to say to the listeners that knowledge is power. So if you have knowledge, whether it's through Joey's legacy to help prevent, something terrible happening for your pet, then maybe it's a good idea to know that National Dental Month isn't a good idea. The little staining on your dog's teeth doesn't require an anesthetic dental cleaning. That is a risk that is not worth taking. And whether allopathic veterinarians truly think it is or not, I'm not sure where they're coming from on that. But knowledge is power, because if you know that, then you know that it's maybe not a good idea to go and do that procedure. And really, the only time an anesthetic dental cleaning is indicated, in my opinion, and I think it's a pretty accurate opinion, but I could be wrong, is if they have a painful tooth that is tightly lodged, that is interfering with their quality of life, that is painful and interfering with their eating. They need to have it extracted, and you can't do that without anesthesia. So, we can sit in a chair and behave ourselves and allow our teeth to be cleaned. It's not realistic in animals, although I do offer hand scale dental cleanings without anesthesia with a cooperative patient. I need one that isn't going to bite me, of course, but most cats and most dogs, I'm able to do a hand scaling. It doesn't get under the dumb line and do as beautiful a job as the ultrasonic scaling, but we don't have to have beauty. We need function. And bad breath is not about tartar on the teeth. Bad breath is a digestive disease. And again, knowledge is power. If you know that, then you know that the dental cleaning might make their breath smell good for a little while, but it's going to come right back because we never corrected the digestive problem. So again, knowledge is power. If you can find a homeopathic veterinarian or seek out somebody like myself, gain more knowledge, because then you can make decisions down the road about what do I do if I'm faced with having to go to the emergency clinic? What do I do if I'm faced with the local veterinarian insisting that my dog's staining or a little bit of tartar on the teeth, or my cat or whatever species we're talking about needs an anesthetic dental cleaning? Because some of the animals, they don't survive from that. And we expect them to, and they don't. Why take that chance over a dental cleaning? Why? Why
Scott, what's the number one thing you get contacted about?
Dental cleanings that go south.
Yep.
Very common.
Very common.
It is very common. And, we've talked about dental cleanings on the show before. And I had done my own outside of this. I started contacting a couple of veterinarians because I have my own theory on this as to why so many animals would die under anesthesia while getting their dental done versus going under anesthesia. Now, they can die under anesthesia for spaying and neutering, but it was so much more. Scott was telling me there's just tons of these coming in through the dental and not as many from the spay and neuter. So I was curious as to why some of the vet friends that I have thought that might be. I had my own theory. I still have my own theory. I think it's because they get passed down to the vet techs that will now be in charge of not only cleaning the teeth, but keeping an eye on the anesthesia machine, the heart rate, all of that kind of stuff. And I think it becomes overwhelming for them. And there needs to be more backup there, the veterinarians. So when you take your my point is when you take your animal to have their teeth cleaned and you assume it's being done by a veterinarian, a lot of times it is not. And so when I used to be the person that did all the dental cleaning, so I completely know how it works. But to your point, I love non-anesthesia dental cleaning as well. But I always say you should have a veterinarian at least present to make sure there's no infection in the mouth or problems or things that need to be addressed, like something needing to be extracted. So I say that because from a grooming standpoint, I know there are groomers all over this country in their vans, at the back of their shops that are offering non-anesthesia dental cleaning. And it really bothers me. It really, really bothers me.
Well, I'll tell you why it bothers me. If you accept what I said earlier, that that dental disease is the oral cavity is the first part of the digestive system. If we don't correct the digestive system, you can hand scale the teeth all day long if you'd like, or do anesthetic dental cleanings, but you are never fixing the underlying imbalance of the oral disease. And so the tartar will come back again.
Yeah.
So if you don't seek out veterinary advice or counseling with regard to that, you'll keep going to those groomers. And I have to say, I mean, it can be stressful for animals. I highly recommend working with a veterinarian. What if the animal gets stressed and arrests in a grooming shop? Do you have the capability to resuscitate that animal? Probably not. And I'm not saying that happens often, but it can happen. Knock on wood, it's never happened to me, but it doesn't mean it couldn't happen. And as a veterinarian, we're always going to be cognizant of, gosh, the pet's getting too stressed, or the heart rate's really up a lot. I should take a break, or I should take it easy, or the pet is panting too heavily, or the gum color doesn't look good enough. We shouldn't expect groomers or back store people, pet stores or whatever the case be. We shouldn't expect them to be experts in being able to evaluate and monitor the patient, even with a hand scale dental cleaning, which is less stressful, but it's still stressful. They have to stay still. They are being restrained, and restraint causes some stress. So we need to be realistic. To answer your point, I believe that in part you're correct about the large number of anesthetic dental deaths. However, what I want to say is that most likely, because most all of these animals are already coming with chronic disease symptoms, that means that they have underlying imbalances that often veterinarians think are perfectly fine or normal, like chronic vomiting or diarrhea, or on Apoquil all the time or Cytopoint all the time. And then they undergo anesthesia, you're exponentially increasing the risk of anesthesia. If they already have existing cardiac disease or liver or kidney disease, and there's no excuse for not doing pre-anesthetic blood work or a thorough workup. I have a really, really excellent client in Virginia that I've been working with for many, many, many years. Her little dog has had the worst oral disease and hasn't been a cured case in my hands, but she does an excellent job. And she was a dental hygienist in her past. So she was really, like on it about cleaning her dog's teeth all the time. It's really cute. So we struggled with this, and there was a point at which her dog really needed anesthetic dental cleaning. To give your listeners an idea, because of the degree of concern I had, because her dog had a history of chronic disease symptoms, I won't go into all of them, could, digestive disorders, etc., and had a heart murmur. She was willing to do like an incredible workup on her dog before the dental cleaning, not only pre-anesthetic blood work, but screening for Cushing's disease, an echocardiogram of the heart, and an abdominal ultrasound, and an EKG. So
Wow.
you can't get much more thorough than that. And the reason that I recommended that to her is I said, listen, your dog has chronic disease. It's really risky to consider anesthesia. I feel that your dog is borderline metabolic. And if we want to know as much as we can before going into anesthesia and doing this dental procedure, which she had done with a dental specialist too, by the way, everybody was really supportive. I'm sure they were happy for her to spend her money on all those tests, but they were supportive for the workup. I'm not saying every patient needs this, but when you're faced with a dog that has a history, even if they appear to be pretty stable, doesn't mean they're okay for anesthesia. And we need to make sure, and we owe it to that pet and we owe it to the client. And by the way, her dog did really well. And her dog had no negative effects from the anesthetic dental cleaning. We all knew it was going to be temporary, but it bought us some time so that hopefully, and she was supposed to die from liver disease at, I think, as a 3 or 4 year old, and she is, I think, 15 going on 16 now.
That's amazing.
And doing well. So,
Yeah.
we have to look at our patients as individuals, and we have to be really, really cognizant and not take these procedures for granted. And that's the thing I think happens a lot with dental cleanings. They're taken as a minor procedure, no big deal. The tech might be handling it. And anesthetic monitoring, it's really difficult. And I've done dentals. When I was doing anesthetic dental cleanings in my past, I don't do surgery anymore by choice. But when I was doing those, it was very stressful because, my assistant wasn't very experienced in monitoring anesthesia. So I was trying to do both. And I'm going to tell you, it is not realistic to do both. So thank God I had somebody watching some monitoring, so that's good. But they really didn't have the skills to be able to really monitor it the way it should have been. But they weren't trained to do the dental either. So I was doing the dental and monitoring anesthesia. They were monitoring anesthesia. But if you have one person and they are doing the dental and the anesthesia monitoring, that is very risky. I don't care if it's a veterinarian, which would be better, or a vet tech. And please don't get me wrong. Our vet tech, or even our non-certified vet tech, are incredibly skilled, really good people. They work really hard, and a lot of them have a lot of knowledge, but they're not veterinarians. And so at the end of the day, as good as they are, we deserve to not put that upon them either. And I've got to tell you that a vet tech that's going to lose an animal under anesthesia is going to have to live with that every day of their life as well.
Every day. Yeah.
Every day.
No, it's terrifying. I was back when I was a vet tech, there wasn't any registration. So I was an unregistered vet tech for 12 years. And I'm telling you, I shouldn't have been doing that. I didn't know. I was so young and I just thought, oh, I'm in control of all of this stuff. And I really wish that vet wouldn't have put that on me. I will call it lucky that I didn't lose anybody while I'm supposed to be watching the monitoring and doing the dental cleaning and doing all that. So I was 18 years old. I mean, come on. Like you said, even having a veterinarian, I mean, when you think about it from a human standpoint, right? You don't put you have an anesthesiologist, you have somebody monitoring the heart rate, you have somebody doing the surgery. We don't just throw you in there and hope for the best. There's a lot that has to be, when you're cleaning teeth, it seems like it's just an easy, tedious thing, but sometimes it's not. You got little tiny things and you got to get into little tiny cracks and corners and you're focusing on that. You shouldn't be focusing on the other stuff. But we do have a question coming in from Judy. So I want to talk about this. And then she's asking for some advice. She says, after losing my horse to gross veterinary malpractice and having my dog burned in a teeth cleaning, I'm terrified of having my 10-pound dog neutered. He's now 2 years old. She says, my holistic veterinarian moved on, so I will have to find a new one, and it's stressing her. quite a bit. So do we have any advice that we can give her for this?
I would say to her, take your time. There's a study out of England that's being ignored in the United States that if we allow our pets, if you can stand it, to stay intact up to 5 years of age, there's a reduced incidence of cancer. So don't be in a hurry to spay or neuter unless there are reasons that you can't wait. Maybe you have two intact, a male and a female, and you're worried about that. But if you're not, take your time. There's no rush to get the pet neutered, and there's no reduction in prostate cancer or testicular disease or testicular cancer. There's no statistical difference. So if you can advantage your dog against arthritis, developmental diseases, and cancers by neutering at a later date, then you have plenty of time to find a veterinarian who could be supportive. Make sure that you do proper pre-anesthetic blood testing ahead of time, and make sure there's a thorough physical exam done. And then also find out, and I don't know what breed the dog is, but there are certain breeds, for example, that should not have certain sedations and anesthesias. Educate yourself about that. And again, knowledge is power. So whatever breed pet you have, make sure there's no adverse events. Ask questions. If you find a veterinarian who will not answer your questions or gets defensive about it, move on. You're not with the right vet. You need to have a veterinarian you can dialogue with, because you should be nervous about anesthesia. I don't mean to scare you. We all, many thousands of animals go under anesthesia, and we lose very few under anesthesia. But the very few are just that many too many. We don't want that to be your pet. No veterinarian wants that to be, your dog. So take your time. You've got time. Find the veterinarian that you need, and then consider a vasectomy instead of a routine neuter. If you are open to that, it is healthier for the pet as well.
I want to follow up for her on her question. So she says that she's going to go ahead and wait until he's 5. What do you think about the older the pet gets, the risk of anesthesia being worse?
I would say for most dogs, if they're otherwise healthy, or cats, and that's harder with cats to wait. I could really get that because of spraying and other things. But with a dog, I think a 5-year-old healthy dog should not be a greater risk than a young dog. I think that the risks of neutering too early are greater than the risks of considering this at 5 years old. The other thing about 5 years old is you get to know more about the patterns of chronic disease that may be in your pet. When they're so young, sometimes we don't know that what crops up and what are the weak areas. Do they have a weaker digestive system, a weaker urinary system? And at no point should any animal get spayed or neutered if they have a genitourinary disease. Have that corrected, hopefully at the underlying imbalance level with a homeopath, before considering any spaying or neutering.
So she says he's a Cotton de la Tua, and I always pronounce that wrong, but it's Cotton.
Oh, I do too.
I just call them Cottons, and now I don't know how to say it.
They're absolutely adorable. Just recently,
I
have a new patient that brought a couple of them to me, and they're so cute.
Yeah,
crazy
they're
how
gorgeous.
cute they are. Oh, they're so gorgeous.
They're gorgeous. But you, in particularly the anesthesia, when you were talking about breeds, you're talking about the bully breeds, the Shih Tzus, the
especially.
Yeah, especially
like
those.
For instance, in French Bulldogs, never ever should a veterinarian use acepromazine, which is a sedative. That can be lethal to bully breed, particularly French Bulldogs. And there are certain dogs that might react adversely, and less is better. There seems to be a practice in veterinary medicine where they load them up with lots of pre-anesthetic medications. The safest anesthesias, if a sedative needs to be used, Versed is a pretty good one. It's pretty expensive, so some vets don't want to use it. And propofol, which is a good induction agent, and that anesthesia is one of the safest. It can cause them to stop breathing, but at that point you should have a breathing tube in that purpose anyway. And then a good gas anesthesia. More isn't better when they're using bunches of different sedatives and pre-anesthetics and all kinds of mix and matches and this and that. At least back in the day when I was doing anesthesia, for the most part, I just used propofol and gas. And I used flower essences prior to anesthesia. If the patient was particularly, frightened and scared and needed a little bit more, I might use something like Versed. But again, that you can check with the veterinarian, but if they're giving you a list of a bunch of different drugs and medications that they're using, remember that every drug you add has its potential of side effect as well. So query or question, well, do I need all of this? If it looks like they're giving you a big long list. The records that come to me, I'm shocked how much is used. And I'm almost sort of surprised how animals sort of tolerate that. And now routinely they want to use anti-nausea medicines. And I never used to use that when I did anesthesia. If they seem nauseous afterwards, I mean, deal with it. You hopefully have an intravenous line present. So give an intravenous or intramuscular injection if you must. But to proactively treat for something that may not occur at all doesn't really make any sense to me.
Yeah, we seem to do that a lot in veterinary medicine.
More than back in the day when I was more around allopathic medicine. It's much more. And maybe that is some of the anesthetic failures we're dealing with, because, remember that every drug that goes into the system, now propofol is cleared very rapidly, and gas anesthesia is cleared through the lungs. So it doesn't have a huge impact on the liver and the kidneys, not so much as a lot of the other drugs we use for sedation and anesthesia. So remember that your liver or kidneys has to clear that drug. When the animal is under anesthesia, we actually have a reduced blood flow in the whole vascular system, which is why intravenous fluid therapy is necessary or recommended, I would say. A lot of vets don't bother to use it. And I think that's extremely risky, especially in the older patient. But if I had a pet I was going to neuter or spay, I would recommend an IV catheter and fluids during the procedure. And remember that you're going to get reduced flow through the liver and the kidney. So what happens to the drugs? They can't get cleared as well. So it's an important aspect to think about. So just because we've always been able to do it without intravenous fluid therapy and we got away with it, now I think we're going to have more problems because animals have more complicated chronic disease problems. And we're going to see more anesthetic death. I just predict it because the diseases that I'm seeing that are much harder to treat these days even with homeopathy, and the crappy foods and the GMOs and the pesticides and the pollution in the environment, all the vaccinations we give, all of the things we do that weaken pets and create chronic diseases or exacerbate them are making them more difficult to treat over time. And the complications with anesthesia are going to exponentially increase. So don't be afraid to, say, yeah, I'd like my pet to have IV fluid therapy during the procedure. How are you monitoring the pet? Who will be doing the procedure?
That's the thing that's the question you need to ask, because I got to tell you, I mean, it's been a lot of years, it's been 20 something years since I've been working in the vet world. We didn't do IV fluids. It wasn't even something offered to the client. It just wasn't done. So when you say, Dr. Cannizzaro, ask how you're monitoring it, you have to really know all of the things that would make it beneficial, like IV fluids. If something went wrong and you need that IV fluid that's already there and in place. I mean, we do that for humans. We should be asking for that stuff and knowing that it's not a given. I think people have this vision in their mind when a human goes under anesthesia that there's all these people in the room and everything's hooked up and we've got IVs going and we've got heart monitors.
Right.
It's just not how it is. But it can be.
In my day, we didn't even have the good monitoring equipment. Later, when I was doing surgery, there was, and I purchased some of it, but we didn't have oxygen sensors. We didn't have heart rate monitors. We had those dinosaur, printout for the EKGs, but they weren't as good real-time information while the patient is under a critical procedure such as anesthesia and whatever additional procedure is going to be done. So don't be afraid to ask what are they going to be using for sedation and anesthesia? What do they use for pain management? That's kind of a crazy topic in itself as well. We went from almost never using pain management to overusing it. And I don't know what happened. Somewhere in between is a really good idea, but going the big overdose way with pain medicines, et cetera, is not helpful for your pet. I don't want them in pain, don't get me wrong, but back in the day when I was doing surgery, most all of the time, we might give an injection for pain and nothing to go home. And I don't know, remember that every animal is going to have a different pain threshold as well. So just like people that can get a tooth extracted and they don't have to use any of the pain medicine that's sent home, and other people are just writhing in pain. Same procedure, maybe even the same surgeon, and they're just crazy and in pain, and they need more pain coverage. So we can't do a one size fits all. And remember too, when your pet goes home after anesthesia, their whole system is depressed, their immune system's depressed. And then when you load on more pain medication, those are respiratory depressants. They're going to make the animal loopy. The animal might get their body temperature might get too low. You could actually lose your pet just because adding more medications after the procedure has caused them to be even less stable. So knowledge is power, what to look for, and I educate my clients to look for. Get used to your own pet. Look at their gums, know what normal gum color should look like in your pet. Look at more than one pet's gum colors. Take kind of a range of an idea of what they should look like. They should be a peachy pink color. Get an idea of what your pet's normal body temperature is. Go buy an inexpensive $5 flexible digital thermometer that can be used rectally. Get an idea for what the normal body temperature is for your pet. It shouldn't go below 99, and it shouldn't relatively be above like 102.8. Get to know your pet's heart rate and respiratory rate. Get an idea of what their normal respiration ought to be. You can count the number of in-breaths or out-breaths, choose one or the other, count it for 15 seconds and multiply times 4. That gives you breaths per minute. If you're not sure how to check for heart rate, you can cup your hand under the armpit area of the chest of your pet and see if you can feel a heartbeat. Or you could try, if you're not experienced, you may not find it, but there's an artery in the inside of the back leg. You could feel around and see if you can feel a pulse. Does it feel regular? Does it feel fast? Does it seem slow? And even if you don't know how to count it, get a feeling for what the normal vital signs of your pet is. This could save your pet's life, not only after a surgical procedure, but even if you're scared because your pet isn't acting well for some reason, this will give you an opportunity to say, gosh, the heart rate seems faster than what I usually experience it to be. Oh gosh, look, the breathing looked like greater effort or much faster. So really pay attention to these things because it'll be a lifesaver. Check the gum color. If they're tired, if they're weak, if they're lethargic, make sure their gums aren't white, blue, purple. They're beautiful colors in clothing. They're a really bad idea in animals. So get yourself familiar with your own pet because you can do a lot at home to know, do I have to rush to the emergency room or, call my vet right away if it's the daytime or, okay, I can breathe a sigh of relief. Maybe this isn't so bad, but I still need to get this checked out. Get to know your pet. It will save your pet and could save your pet's life.
Sure. Scott,
Yes.
I know you have your hand up, but can I just really quick, I know that it's important for this to point out that we get so many cases, right, of pets dying under anesthesia, but that's not how you lost Joey, right?
No, we lost Joey because we didn't have labs. The vet figured that he knew what was wrong, and he was trying to save me, $99 for labs, and instead gave him a $92 injection of Convenient. So he didn't really save me any money, and I say he caused the death of Joey.
Yeah.
Because had he done labs, he would have seen there was kidney values were up and needed to be treated with renal friendly drugs, and of which Convenient is not one. So,
well, I think
I call that guess treating.
Yeah.
It's so important that your listeners hear, and I believe I know from Scott's story that he asked for labs and the veterinarian said, no, it's not necessary.
Right.
I know what I'm doing.
Exactly.
I know what's wrong.
Yes.
I don't care. I don't want you ever to come and tell me that a client comes and says, my veterinarian said that this growth is not malignant by looking at it. I'm not suggesting aspirations and biopsies. I'm not big on that, but check with me if you have an interest. Or looks at your pet and says, I know what's wrong. We'll just treat with these drugs. We do diagnostic tests for a really good reason. because in order to use the dangerous drugs that you might potentially be using in allopathic medicine, you need to know that the drug is not going to be contraindicated. Otherwise, you're
Right.
going to have a Joey,
Right.
a Scott Fines Joey. We
Right.
don't need to have Scott Fine Joeys. We could have
No, because we don't need another organization. This one has got it. So we gotta,
Yeah.
you know what I mean? We don't need another Joey. We've got the Otises and we've got the Joeys, and we just need to end this. But Scott, I know you had something you wanted to say.
Yeah. Okay, so we do have the question from Natalie. And
oh, good. I couldn't get it. So
yeah, well, I had her, she texted it to me.
Oh, okay.
So here it is. I kept 2 of my girls intact for 2 years to protect them against certain types of cancer, like the doctor was saying. But for those of us who rescue and adopt shelter animals, we cannot unless all of ours are spayed and neutered. They are totally inflexible about it. My bigger concern is having a deceased pet after a simple surgery or some other procedure.
Natalie, it's there are some rescues that will adopt out if they understand the reasons for the pet not being spayed or neutered. And I have an intact male French bulldog. He was born with neurologic disease. He has chronic vertigo, and he has neurologic disease where if he gets really excited, he runs in circles. I elected not to have him neutered, and he's 6 years old, because I feel the risk that he's going to die under anesthesia is greater than being anal about getting him neutered. It's kind of a pain not having him neutered, but I'd rather have him alive and not neutered than dead and neutered. So if you have reasons that, for health reasons, if you have a strong veterinarian that backs you, that veterinarian can and should go to bat for you if you want to adopt from a rescue. If the rescue is a particular Nazi about their procedures, because they can choose whatever policies they want, it doesn't mean that they make sense or that they're sound, then go to a different rescue. There are rescues that will adopt out to people that have intact animals. Now, you're not necessarily going to get a rescue animal that is intact. That's uncommon. And this isn't a question you asked, Natalie, but I think it's an important one to raise here. Don't shy away from rescuing an animal because they're going to be spayed and neutered too early. Yes, it's a problem, but rescuing an animal is more important. We'll do the best we can to keep them healthy after getting spayed and neutered too young, especially the ones that are done really young, like 8 weeks old and 12 weeks old. It's too young. But you know what? We'll do the best we can. So I want to encourage people to rescue in spite of it, even though I may talk about, well, it's better to do this and this. We can't always have that. A lot of these rescue animals are heavily over-vaccinated. We have to deal with that too, and the diseases that comes with that. But don't let that deter you. Most of my dogs are rescues, the majority of them, even though they're purebred. And they're rescues, and they're totally worth it. And they're not necessarily the least unhealthy I've ever had. So I know that wasn't a question Natalie brought up, but I think it's a good one to address.
I'm glad you brought that up, because I do rescue. I bottle feed kittens. Everybody knows that. You've probably seen them on my shoulder. So I work in rescue, and it is very, very hard for me to know that the animals that I've bottle fed are going to go back and get spayed and neutered at an, in my opinion, ungodly young age, practically before anything's even dropped or done anything. But I will say, I am so glad you brought that up, Dr. Cannizzaro, because for a while there, I was getting to this point where I didn't want to even be involved, because it was driving me crazy that I had to take them back to get all of their vaccines and to get all of their dewormers when I know they don't have worms, and, you know, get them spayed and neutered and all the stuff they're going to do. And I've fought and fought and fought, and I cannot win. So for me, I know it's that much more important that they eat healthy, that they stay in a stress-free environment, that I don't, you know, as long as I have them, you know, and I do like a little write-up, and I give it to the owners about if they want. I even give discounts if anybody adopts them from there to come get good food, because that's all you can do is take what already happened and then set them up for success. And even when you buy a pet from a breeder that you aren't going to neuter, a lot of times, right, they're coming with unhealthy guts already that you have to work with too, whether, their parents are passing down unhealthy guts. So not getting it from a rescue isn't always going to prevent you from getting an unhealthy dog, is my point.
A lot
It's
of
really
breeders,
about what we do after the fact.
a lot of breeders really are not up to speed on vaccinations and how few to give. And then that said, to your point, I work with a lot of rescues, and sometimes it is really challenging because I know what's going to happen to those animals. And I have a really good rescue I work with up in Connecticut called Passion for Paws. And fortunately, the person that is most involved in that rescue is she's also a homeopathic client of mine. So I treat all of her pets homeopathically. But at the end of the day, she knows that these kitties, they do cats, and they try to take out elderly dogs and things like that. But anyway, they do the best they can. But I know that they may go on to a home that's going to vaccinate. One of the things that we can do is and this might be helpful for you, is I have to understand that I'm going to do the best I can to treat the ailment. There are certain cases that I treat that some of these cats I'm thinking of in particular that I've treated for her have such serious disease that I say to her, there's no way that this cat can ever get vaccinated, period. And she has an intact male cat that's a compassionate forever foster that is a congenital nightmare. And he has congenital kidney disease, and he wasn't supposed to live. I think he's going on 4 or something. And he developed epilepsy at about 2 or 3 years of age that we're managing homeopathically. But this kitty never got neutered. Why? Because the risk of neutering the kitty is he's probably going to be a dead neutered kitty than a live intact kitty. And she doesn't vaccinate this kitty, and they eat raw diet, and they're on very good food. But certain of the ones that she adopts out, she does do contracts, like if there's a congenital heart problem or a congenital neurologic issue or something like that. And I'll say, listen, this cat is not safe to be vaccinated ever again. And she will put a contract together. Now, whether they honor that or not, we can't say. At the end of the day, if they get a loving home, all we can do is educate, and knowledge is power. If people will take in that education and do something good with it, then the pet, even if it does get vaccinated more than it should, or maybe they use flea and tick poisons once in a while, hopefully not often, or hopefully never at all. When you're doing that kind of thing, I mean, it's got to be better coming from a rescue that's going to try to educate. And if they do try to educate in the good way, people will maybe hold on to something and do something really good, and then a few things maybe not so good. It's the best that we can do, but if the animal lives in a loving home, we've still done a good job at the end of the day. Even if it's not perfect, and even if it's not the way that I'd like to see it being done, we're not going to convince every person in the universe to do things the optimal way, because there isn't enough there isn't enough of us, this type of veterinarian, to help educate people, because they will listen to you. They'll listen to a veterinarian more, unfortunately. And so when you say something powerful and true and correct, and their veterinarian debunks it, they're in a quandary. Well, I don't know. I guess I should really be believing my veterinarian, but I like Carrie a lot, so I'm not really sure. And it doesn't give them the power to really utilize that information as powerfully as they should or ought to. So unless this gets to be a more dominant paradigm, and it is, because people are getting more scared of vaccinations, and as they should be, and not all vaccines are bad, so don't get me wrong. But when we over-vaccinate, it's just outright dangerous, and there's no medical validity for doing a practice such as that. There's never been a study that has proven that annual vaccination is healthy, helpful. If anything, we know through data and studies that it causes harm. And I see vaccine disease in my practice every single day.
Yeah, definitely. We've talked about that before, that the induced
veterinary
diseases that are coming on. We did a whole podcast on it. So I'm just going to shift us here a little bit, because we're coming up on the hour. And I know Lauren was our veterinarian that was going to be here. She got stuck in a deposition, it looks like. So that's the life of a lawyer, right? The life of a veterinarian is getting, stuck. I shouldn't say stuck, because it's something we love to do. But so Lauren wasn't able to join us, unfortunately. So, but this has been such valuable information. This is what Scott wants to do with this
Right.
group is prevent veterinary malpractice and prevent you from being in that situation. That's the number one. And getting this documentary made so that we can get more information out there and show support to veterinarians who may be not on the fence to put their hands up and say, hey, something's wrong. But when you feel like there's a lot of support behind you, it's a lot easier. So that's what Joey's Legacy is doing, is providing that support to some veterinarians, and why we're trying to get the documentary made. So I'm going to shift this a little bit, Scott, over to you so we can talk a little bit about the documentary, what's going on with that, what we need to do. I know we had the sizzle reel come out, which was amazing.
Right.
Amazing. Dr. Cannizzaro, both you and Scott, I'm amazed at how well I shouldn't say amazed. I expected it from you both, but such a great job that you did in speaking on the sizzle reel. And for our listeners, if you haven't seen it yet, please make sure you watch it and share it everywhere and anywhere that you possibly can. But Scott, tell us a little bit about what's going on so far. What happened right after you announced that sizzle reel?
Well, the people were sharing it at such a crazy rate. I was getting messages, hey, I can't view it. Google won't only allow a certain number of shares in a 24-hour period. And I said, just keep trying, you'll get through. And then as the days passed, the number of requests for the link, tapered down. But you know what, Carrie? We have two goals with all of this stuff. With Jerry's books, and volume 2 is coming out in a couple of weeks. With John's documentary, we have two goals. We want to expose the fact that this kind of stuff really does exist. I went decades, never a problem with any of the veterinarians I ever had. I had a couple dozen dogs and cats over the years. I think a lot of people will tell you the same thing. And then we all hit a brick wall one day. And, about 75 to 80% of the people that joined Joey's Legacy state, I have never had a bad experience with a vet, but I'm hearing all this stuff. I want to join your group. I want to see what it's all about. I want to hear what other people are saying. And I want to protect, I want to educate myself so I could be a better advocate for my own companion animal. And that's the other goal, educate as many people in the world as we can, about how to better advocate. I mean, yeah. Vet boards are going to be there. They need to be dismantled and restructured. I don't know if that'll happen in our lifetimes. They are the root of all evil here. Okay. They are the root of all evil. They allow serial offenders to continue to maltreat their patients. And this is a pattern that continues on and on. So we have to find ways to, kind of get around it. We educate, we expose the fact that this stuff exists. And, we love our vets. It's a glorious, wonderful profession. And there's, like any profession, there's a handful that kind of, taint the reputation of the profession. And we want everybody to understand that they need to share what our message is as far and as wide as they can. Promote the great vets like Dr. Cannizzaro. And don't let the bad actors, and when I say bad actor, I want to make sure everybody understands, a bad actor is not a veterinarian that commits an act of negligence or malpractice and comes out into the waiting room with sincere remorse and contrition. I'm sorry, or it takes you into the office, obviously, either way. I'm sorry we did everything we could, but we couldn't save your companion animal. That's not a bad actor. A bad actor is where a companion animal is lost as a result of an act of negligence or malpractice, And the vet figures it's a lot easier just to lie about it and cover it up. So the deception, in my opinion, in my world, is what brings in the bad actor. For months before Joey died, into the previous year, this same guy who is a substitute vet there, he's not even Joey's regular vet, told us Joey had a lipoma on his tail, about the size of, small, not that big. I said, what do you think about that? No, we don't remove those unless it affects the, if he had trouble walking, it was located in a certain place where he'd have trouble walking. So we might remove it, but we normally don't remove lipomas. Okay. When it was his turn to send Joey's records to the state of Florida, he had the nerve to put in there, advised patient to remove lipoma, patient declined. Wow. In an attempt to make me look like a lousy pet parent.
Wow.
And he put a couple other things in there. I don't pay my bills. I never had a bill. It was always a zero balance with the vet. So anything, he's trapped in a corner. What do you expect him to do? He's not a legitimate guy. He's just a low-life creature. Fortunately, his type is not in the majority. So again, we are out to educate and expose the fact that this stuff goes on. And we're going to do our best. We need some help with the documentary. Please don't say, let the other guy donate. All we're asking for is $5 a month. $5 a month. Establish your recurring donation at our membership site. You'll have access to all these great podcasts, all this great information, plus a number of other perks that you can find on the membership site. And join us and tell your friends and stay with us. And let's get this documentary made the way we know John Bafar can make a documentary. Here's the 9-time Emmy-winning producer and director. Okay, so this is not a guy with a cell phone running around with his camera taking pictures. Okay, this guy,
absolutely not.
This guy is well established. He's produced and directed. If you get, I'll probably date myself here. Ernest Borgnine, Artie Johnson from Laugh-In, Ali McGraw from Love Story, and the list goes on and on. Ali McGraw is a good friend of his. Okay, so the sizzle reel, I could say you ain't seen nothing yet, as they say, because the big film is going to be absolutely spectacular, and I'm hoping it'll be John's 10th Emmy. But we need your help. We can't do it for free. He's got travel expenses. He's got a film crew. There's cost to edit. I mean, it's time consuming. It's not, it's not something that can be done gratis. So please consider joining us. $5 a month. You can cancel at any time, and we'll do our best to educate you with great gifts.
Don't forget to sign up for Smile on Amazon.
Yeah.
I know I say that all the time because I am signed up for it. And every time I purchase something, I sound like a shopaholic. I'm not. I have to purchase for my business there and stuff. But every time I go on there, maybe I am a little bit of a shopaholic. Actually. Every time.
Okay.
Yes,
every time I'm like, dang it, I think I am a little bit. But when I go on there, it always tells me how much will go to Joey's legacy. And it may be $1 or 50 cents, but I think, oh man, like I've just been doing that for like 6 months. That has to have equaled up to $15, I would think, or 20 or 30, maybe even. I don't know. Does it? Hopefully, it doesn't tell you how much I did. Then it's really going to be.
No, it'll. If I even go to look for it, it'll give a cumulative amount. And
okay, good, because I don't. I need it to be obvious. But my point is, especially because the holidays are coming and I know people are going to be shopping on there, please sign up before you do your holiday shopping on Amazon. Please, please, please. It's really easy to do. When you go onto Amazon, you click onto your the little 3 things and it'll say smile is what it's called. And Lori just put a link there for you. So it's super easy. Lori's in the background nodding her head. She's the one that helps us do all of this. Thank goodness. But please sign up with that before the holidays. I know you're going to be doing some holiday shopping, so that would be really, really helpful for us to get this documentary made. Scott, I just want to point out how much I love that you said veterinary malpractice and lied. That point is so important because I have worked for veterinarians who, one in particular, this was years ago. I've talked about some veterinary malpractice that I've seen before, but one in particular case that I saw, this veterinarian felt so horrible about it. I mean, it really, really affected, honestly considered leaving the whole entire profession because he felt so horrible about it. But he didn't lie about it. And that is where I think some things are different, and where we have to really realize that veterinary malpractice can happen not because the veterinarian doesn't care. I hate to call it an accident because sometimes it's just things that they allowed to happen. So it's not necessarily an accident, like not hiring enough staff, about like different reasons. Dr. Cannizzaro, I'm sure you know what I'm talking about. There's different reasons it can happen that still make it the veterinarian's fault, but never in a million years did they think it would happen because maybe it hasn't happened to them. But that lying that you talk about,
Right.
Scott, is
Right.
there's
Exactly. Well, that's what separates. I mean, any profession has, you can commit an act of negligence in any profession.
yeah.
It's not exclusive to veterinarians. Let me give you not a happy story, but it'll prove my point about great veterinarians and not so great. So 2 days after we took Joey back the second day to the vet. That time, his regular vet was there. Good guy, great guy, did labs right away. Why didn't they do labs yesterday? I don't know. Ask the other guy. They'll tell you. I have no idea. I asked for him. Okay, so we did labs. The bun and the creatinine were crazy. He said, we're going to do what we can. Going to keep him overnight. And we got a call the next morning. And prognosis is poor. You guys need to make a decision. So we did. And we went to the vet hospital. And Joey's vet was in the room. And we all gathered around Joey. And he did what he had to do with Joey. And my wife and I, all sat there with tears in our eyes. He did as well, because I know he felt horrible about what happened. This is the kind of vet you want. The vets that feel it when they have to give that injection. So let's do what we can. There's 85 million companion animal parents in the United States, a few hundred bozos on the vet boards, 50 vet boards, 7 or 8 on it, 400 bozos. I have different terminology I'll say for another time on vet boards who are actually, ironically, talk about two-faced. They're practicing veterinarians, most of them. They're in their offices doing what they do every day, providing compassionate care for their patients. And when it's time to become a vet board member, they become insensitive, uncaring, and indifferent toward the same companion animal parents, well, not the same ones, but, companion animal parents who are just trying to seek justice for what happened. And they refuse to discipline firmly and fairly. And that is what has created this big mess that we're in. It's all about the vet boards.
Well, we're making some progress. I know that for sure. Progress is being made. It always feels, I remember when I was fighting so hard to get people to understand that kibble isn't the best thing to feed your pets. And I thought I would never, ever, ever, ever see the day that people started putting fresh whole foods in their pet's mouth because they were so convinced that kibble would clean their teeth. And I can't even give you the list of things, but it took a long time. But oh my gosh, it's so rewarding now to see this fresh food go in their mouth. And Scott, I got to tell you, it's so rewarding to hear people say to me, I'm listening to your Joey's Legacy situation. And he just had an attorney the other day who I think I told you if I hadn't, it was going to, that might be contacting you, who might come on board with you if you'll have him. So, sure. Just that for them to be like, wait a second, there's an organization that I can become a member of that can help pets. I want to be involved in it. So watching this happen is just, it's so amazing. And I'm sorry I got silent there a little bit, but while you were talking about Joey, I can still feel the pain and see it, on your face all these years later. And it's what drives Joey's legacy. And so I just want to take the opportunity to say, I'm sorry that you go through it, but I appreciate you so much for being willing to change this, because I'm tired of seeing it.
Right.
And
it's so many. Yeah. Thank you. We all are. And we need to just keep going.
Yeah. Dr. Cannizzaro, thank you for being honestly just like in the forefront of this. I mean, we need a vet for the roundtable. Dr. Cannizzaro is like, hey, I'm here. Listen, I mean, she is just amazing. It's just so amazing that you just keep speaking. It is very scary. I just want to tell you guys, from a veterinarian who is still active and running a business, it can be really scary to speak up. I don't know if you're going to admit to that, but I'm going to tell you, I know somewhere she wonders, I hope I'm not really messing things up for my life, because it is really scary. You can get beat up. People can say all sorts of horrible things about you. And so thank you for having the courage.
Absolutely.
To speak up.
And that was my point. That was my point earlier with the 8-minute sizzle reel. You were so forthcoming and so transparent, and very, very few vets would be willing to do that.
It's scary. It's scary.
But on the other hand, if they were, it would be all the ethical vets, 5,000, bad actors, 200.
Yeah.
Yeah. And, the diversity is what I'm trying to say. All the ethical vets would band together and say, yeah, we need to speak up. We need to get this out there, because a lot of people still think I put a Google review on after Joey died about this particular vet. And, there's one in every crowd, no matter what you're talking about. Some guy comes on and replies, he was doing your dog a favor. Your dog was 12. It was almost time to him for him to go anyway.
Oh my!
Now this guy's a provocateur. He's got a reputation, but I took the high road. I didn't respond, and I just realized he's a lunatic. That's all. So the point is, just like Joey's vet and all these other bad actors, that wasn't their first patient. They didn't just get out of vet school, and that wasn't our lost family members were not their first patients. I guarantee you, obviously, and you can affirm this, they've got hundreds, maybe thousands of success stories where patients were treated properly. And then here comes a Joey or, another case. Because if they were that wholly incompetent for an extended period of time, sorry, maybe I'm naive, but I can't imagine them, they'd be run out of business. This is just now, and not only use the word now and then, because it does seem like we're unfortunately taking more and more calls. We're getting 1 to 2 inquiries a day, where we used to be 10 to 15 a month. So we'll just keep fighting. That's all. We're not going away.
Yeah, I'm not going anywhere. We're
I'm
here.
not going anywhere. Being a target, by the way, because I'm a homeopathic veterinarian, so I'm not well liked by my colleagues for that reason. I don't mean
Yeah.
all of them, don't get me wrong, but it's difficult to step out and to step out in the forefront and talk about things that go on in our profession, and even things that have happened in my life that have been really traumatic. If we don't talk about it, then we can't get this out, and we can't help all of the individuals. We can't grow, we can't learn how to do better. And we need to learn how to do better, because I don't
Yeah.
think there's any veterinarian that wants to go out there and just take the life of somebody's companion animal for
Yeah.
them.
No.
And that's even the bad actors. What's bad is what Scott said is what happens after. It's the what
Yeah.
happens after that's the worst thing of all. And we have to, and it's got to be the most difficult conversation for anybody to have under any circumstance. So we have to keep out there and keep fighting. And I want to say to listeners, we need changes across the board in veterinary medicine. I mean, I just got a case from Joey's Legacy that's really difficult to me, a pet that died after a vaccination. How do you fight that one? I mean, the vaccine was definitely at fault for the death of the pet. But do you think the veterinary boards or a law case is going to prevail on that? It's so hard. I mean, they deserve to have some kind of justice. And quite frankly, it should be against the vaccine company, but they have themselves well hidden and insulated against lawsuits. I'm not saying it's not impossible, but it's in veterinary medicine, when we are using medications that kill Joey, at least if we use those medications with knowledge that there isn't pre-existing kidney disease, then maybe you could get away with it. And when we don't do the proper lab testing, et cetera, and when we portray vaccinations as being perfectly safe and not letting the public know, be a part of this group, listeners, because if you are, then you get to know. You don't have to be afraid of everything in veterinary medicine, but you need to think critically. And please don't expect your veterinarian, especially your allopathic veterinarian, to always act in the best interest of your pet because they're busy, they're allopathic. They consider chronic vomiting in a cat to be, oh, well, all cats throw up hairballs. It's no big deal. That's a sign of a digestive problem. So find somebody who is going to take that on seriously so that we don't have to have more pets that suffer through veterinary induced diseases or through injuries, accidents, and cover-ups and lies, because we shouldn't have to have any of that. Right. And I don't want to see a companion animal have to suffer any more than the next person. And I see a lot of suffering that comes through my doors, and the clients suffer too. So,
absolutely,
knowledge is power. So educate yourself so that you can go into these decisions more informed, better educated. And if your veterinarian doesn't want to do lab tests, then find another one, before treatment takes place. If that were to be the case, whether it's an emergency room or anywhere else, or, jump up and down and insist, do whatever you need to do. But we have to be our own fur children's advocates, because we can't always guarantee that the veterinarian who is busy, tired, underpaid, maybe has family issues at home, whatever the case might be, we can't necessarily, or, not enough sleep. Maybe they did a double shift. I mean, I remember a time in my career where I was working triple shifts. I mean, I really, thank God, I can't remember anything bad happening to a pet. But, I was young and dumb. I thought, well, more money, I'll just work 3 shifts, no sleep. Yeah. Is that my best self? No, of course it's not. So educate yourself, get educated, ask a lot of questions, and be your fur baby's advocate, because we can't guarantee that the veterinarian you're facing is necessarily going to make exactly the right choices or advice to you for your pet.
I've been telling my clients, if they can afford this, and I hate that it sometimes unfortunately does come down to money, but if you can afford this and you are seeing like Dr. Cannizzaro said, her office calls are about an hour and a half long. You could ask your veterinarian if you can book 3 appointments back to back to back. and pay for those 3 appointments that they normally have scheduled. And that doesn't mean that they're going to give you the better answers. It means they'll be less rushed, and it'll give you more time to communicate and try to get more information to this veterinarian and give her time to slow down and be able to just communicate with you. So if that's another thing we haven't talked about on this show. I just recently started telling my clients, you know what, ask if you can buy 2 or 3 back-to-back appointments if they're rushing you out too fast. And I think that makes the vet also go, oh, this person's serious and I need to take more time, and maybe they'll hear you. And maybe just doing that will make them think, you know, maybe I should charge more and have longer appointments instead of rushing you out in 10 minutes. So that's just another little piece of advice I have been giving my clients to try to reduce the errors that happen in that quick exchange that's going on. So,
and if you're considering a serious procedure, perhaps book an appointment to discuss that procedure with the veterinarian prior to embarking on it. That way you can ask a whole lot of questions. And I charge by the hour, and I want to dispel a myth that a lot of people call up and they freak out about the hourly rate and, oh my gosh, the first appointment's an hour and a half. A homeopathic veterinarian in the long run will actually save you a lot of money, because the first appointment is an investment. But once you finish your first appointment, you have power information to be able to use for your other pets, number one. And secondly, every appointment builds upon itself. So the follow-up appointments are much shorter duration. And if you think about it, and I don't know what the rates are in California, but let's just say that your examination charge with your veterinarian is $60 or $70. If they spend 2, 3, 5 minutes, do the math. Divide that into $60 or $70, and don't tell me that my $4 a minute is more expensive, because it's not.
No,
it's not.
So
it's not.
If you do divide it out, some people think, oh, I don't need an hour and a half of your time. I need that much time to be able to collect the necessary information to be able to put together an understanding of your pet, so that I can formulate a treatment plan and a wellness plan that is going to be specific to your individual pet. So don't be afraid to book some extra time with your vet if they're willing to do that, and make sure they spend that time with you. And don't rush out of the room quicker and think that they've got a 10-minute coffee break. So you deserve, I think every veterinarian should charge by the minute or by the hour, because I think it's fairest. And then you can charge a lesser rate for the tech time, not because they're not valuable, but so I think that's fair. And if that were the case, veterinarians would be really freaking out. They'd be, oh, wait a minute, I think I'd like to make that appointment longer. So whatever you have to do to get them to listen and get your questions answered. But what I would say for sure is that if you do find a veterinarian that's really defensive, that's a red flag. That's a really big one. They don't want you to ask questions and find a nuisance asking questions. It can be hard, I get it. But the bottom line is that, I'm here to educate you. I'm here to try to help you make the best decision on the well care and the treatment and the health care for your pet. And if you can't ask questions to me, then how are you going to get the information you need? How are you going to understand the process well enough? So I really, again, can't say it enough. Knowledge is power. And I was just tearing up listening to Scott, because his story is not a rare one. It's not an unusual one. And every one of these stories are so difficult and so touching, because I've been, I do euthanasia, standard euthanasia, and I shed tears, even with people I don't even know, that there's a local water cremation place that recommends me for euthanasia all the time. And please don't do that. It's really stressful. But I don't even know some of these animals, but I know what they've meant to their people. And so I don't even have to know these animals or have a long history with them. My own case, are you kidding? I need a tissue right along with them. But even the other ones, often I'm shook at the end of that. There's no question about it.
Right.
It's hard.
Yeah.
All right, guys, it's 6:30. We went a long time, and thank you. You guys are on the East Coast. I'm on the West Coast, so it's no big deal to me. It's 6:30 to me, but what is that? Is that 9:30?
9:30.
Well, thank you guys so much for I know it's hard, and thanks for switching the day too.
That's
really
fine.
appreciate
Yeah,
switching
no
the date.
problem.
to Monday.
No problem. No
It
problem.
means it meant a lot to me and my husband. So
Good.
thank you guys. I'm so glad and grateful to be a part of what you guys are doing. You're just
Thank you.
both amazing people. We'll find out about Lauren. Hopefully she's okay. I'm sure she says she was stuck in a deposition. So hopefully
Bless her heart.
she's fighting for the rights of dogs. We know that that's what she's out there doing.
That's what she does.
I
Yeah.
hope so. And
So
Scott,
she's
thank
out
you
there
for
winning
all
a
you
case.
do.
Yeah. All
Scott,
right,
thank you
everybody.
for all you do. You're amazing in the sizzle reel. And
Right.
Carrie, you're amazing. I always enjoy doing anything and everything I can with you. It's just
We thank you so
wonderful.
much. Thank you.
Thank you.
Yeah.
Be well. Thank
All
you
right,
so
you guys
much.
be
Well,
well.
everyone.
Take care, everybody. Thanks
Bye-bye.
for listening.
Yep.
Bye
Bye-bye.
for now.